morning. I'm Dr. Richard Laveley, and I'm the president of the Dr. Tom Dooley Foundation, and I have some very exciting news to report this morning. It's June 22nd, 2014, Sunday, and I just received word from Cameroon from Dr. James Brown, Captain, U.S. Retired Navy, who's training 9 residents at the Mbingo Baptist Hospital, that the life of a 29-year-old woman has been saved. She came in an extreme condition with a large pleural effusion on the left side of her chest. Now, this means that approximately a half a gallon of fluid was located in her left pleural space. Now, I realize that a lot of you don't know you even have a pleura, but trust me, you do. It's a space that enables breathing on the left side of your lungs, and when it fills with fluid, it pushes the left lung, the right lung, and the heart over into the right chest cavity, which eventually stops circulation and causes death. This woman had approximately an hour to 2 hours to live when she presented. She was in grave danger from shortness of breath and unconsciousness. Dr. Brown and his residents were able to put a chest tube in the left side of her chest and drain out this fluid into a Pleurovac that was donated by Atrium Medical in New Hampshire. The Pleurovacs that are donated by Atrium Medical are called Oasises. And with a trained thoracic surgeon that did not have a Pleurovac, this fluid could not be able to be drained from the chest, and this woman would have died. So we're very thankful to Atrium Medical for its donation of Pleurovacs. We're very thankful to the Pan-African Academy of Christian Surgeons who support Dr. Brown in Mbingo Baptist Hospital in Cameroon, Africa. And we're very grateful to the White Cross for helping transport the Pleurovacs to Africa. And thank you to everyone for enabling the vision of Dr. Tom Dooley to help people of the third world with medical problems and those who ain't got it so good. Thank you very much.
Dr. Brown did provide us some pictures of the patient, and you see her here with a smile on her face, and I guarantee you when she presented for care she didn't have that kind of smile on her face. Here's another picture a little farther back that shows the accompanying person with her, and if you'll notice, the tube coming out of the left side of her chest goes down to the Pleurovac. Here's another shot of the chest tube coming from the left pleural space down towards the Pleurovac. And finally, here's a shot of the tube going from the Pleurovac to the wall suction. And it's the job of the Pleurovac to adjust the suction from the wall to the appropriate amount of suction needed to remove the fluid from the pleural space, which will in this case take about 4 days. So a single drainage is not enough to cure this problem because the drainage will continue for about 4 days, and then when it slows down to next to nothing, the chest tube can be removed and the patient can return to normal activity. And here's a picture of Dr. James Brown with the 7 boxes, 6 Pleurovacs per box of Pleurovacs, and there's the Atrium sign. And this is the wonderful Dr. James Brown from Cameroon, Africa, the Mbingo Baptist Hospital. He's the director of the training program. He's a retired captain in the U.S. Navy, and he lives over there with his wife, who is a nurse, and they've been over there about 6 years now. He has 9 residents. He works about 120 hours a week, and when these pictures were taken, he was standing in the supply room of the OR. When they were actually delivered is when we wanted the photographs, but he was in the operating room when they were delivered. So God bless Jim and all the hard work he's doing over there and the wonderful training he's doing of the Africans to take over surgical care of their countrymen.